Ladies and gentlemen, this is your favorite doctor, the doctor for free, coming to you all the way from New York City. The topic for today might sound a bit far-fetched when you hear it, but it is within us, it abides in us. It's something that is rampant. It is so pervasive that we really need to pay very good attention, because most of the things, the calamities that arise from this ailment are ascribed to a whole lot of myriad things, including superstitions, myths, misconceptions, and misdiagnosis. But it's something that if we pay very good attention, we should be able to obviate the ill effects and maybe the most cataclysmic consequences. It is none other than the twin topic of deep vein thrombosis, also called DVT, and embolism, with the poster child of pulmonary embolism. In due course, I'm going to explain these things and try to bring it down to the level everybody will understand. Thrombosis in medicine is the formation of blood clots or clots. So a thrombus is a clot. So thrombosis is the formation of clots. Then when any of these clots breaks off and travels to a different site to cause a calamity, that process is called embolism. Embolism is more like the movement. It's not just blood clots that can embolize. You have fat embolism, people who had fractures and the bone marrow, fatty bone marrow will embolize. You have amniotic fluid embolism in pregnant women, but those are topics for different days. We are trying to concentrate on blood clots, thrombus, and embolism. Why is this topic germane? We've had a lot of people that travel from long distances, maybe abroad, UK, United States of America, other parts of the world, fly down to Nigeria. Before you know it, they are rushed to the hospital in excruciating chest pain and shortness of breath, and before you know it, they give up the ghost. Most of these things will be attributable to pulmonary embolism. When we say pulmonary in medicine, it just means the lung, airway, and breathing. When we say cardiac, it means the heart. So I'll be using some of these terminologies. Remember, this is a platform to teach the non-medical people about their medical ailments, so that they will be conversant with these ailments, so that when they go to their doctor, they will sound a bit enlightened, and they will be able to ask relevant questions and make some arguments that will, at the end of the day, improve their outcomes. These things are given in the Western world. Patients come to me all fully aware of their circumstances and well knowledgeable. In fact, at times I have to ask them the names of the medications they use and what it is, and it's just what happens there. Patients come to us well informed. That's not the case in Nigeria and most of the African countries, and that is why this lecture series is just aimed at educating the populace to know their rights, to know the basic and the rudiments of their ailment, so that they are so informed or enough to go to the doctor and make contribution towards their care, which at the end of the day, if you have a good outcome, it's you, it's not the doctor. See, they practice grandfatherism over there, where the doctor is so also full of himself that he thinks he can lord it over the patient. At times when patients ask questions about their ailment, the doctor would dismissively ask them if they were doctors or if they were medical practitioners. But that's, you have to provide the information to the patient. That is how it is here, where I practice in the Western world. It is a given. Patients will stop you, keep you there for 30 minutes if they want, even when I'm asking you questions, peppering you with questions, and you don't feel insulted, you feel honored to answer. Maybe I wouldn't expect such effusiveness in Nigeria because of cultural differences, but there should be a modicum of enlightenment or teaching for patients to know what they are dealing with. Some even get medications that they don't know what it is, the names of the medications and what it is for. This is just absurd, outlandish. We hope to change these things in due course. So going back to the topic at hand, why this topic is relevant is that there are things that can predispose you to blood clots, especially in the deep veins. Remember, the arteries carry blood away from the heart to supply to the tissues, and they are muscular, so they can pump, they can pulsate and push blood easily. But this is not so with the veins. They have thin walls, they don't have muscular walls, they cannot pulsate. Blood flows by imbibition, so like passively through them. The only reason that you don't have damming back of blood to the lower areas is because these veins have valves that unilaterally direct flow, and if it tries to flow back, the valve closes. You know how valves work. That's the only thing. So that's why you see some people with varicose veins of the legs looking serpentine, like the big snake around the calves and lower legs. These are people who lack valves those are superficial veins, so the blood will pool in there. But I'm talking of the deep veins that we don't see, the big veins in the deeper part of the leg. So what aids in blood return to the heart through the veins is the muscular pumping of the muscles of the legs. And the way the muscles of the legs pump is that you have to move around. So if you lead a sedentary life, or let's say you had major surgery and you're laying in bed for long, so your muscles are not pumping, the calf muscles and all that. So blood will pool. The blood that normally pulls back to the heart through the pumping action of the muscles of the body, not the muscles of the veins, because they don't have muscles, will pool. And it's just like if you leave a dirty water, muddy water in a glass cup, you leave it to settle. Come back 3 days later, the top of it will be clean water. All the debris will settle to the bottom. That's how it happens there. If you juxtapose this with, say, what happens in the veins, if you are not moving around too much, so blood will pool in the veins in your legs. And then, due to the viscosity, things can sediment and then form thrombus. The other things are predisposed to the propensity for this. Like in the Western world here, a lot of the girls are on birth control pills. We don't really know much about it in Nigeria. I mean, it's just an infinitesimal aspect of the population that are on birth control pills. But here, majority are. So such pills can predispose a young girl to deep vein thrombosis. Then other ailments, like cancer, even pregnancy. Pregnancy leads to a hyperviscosity state. I say surgery, major surgeries because you're not moving. People who just, have debilitating illnesses that prevents them from moving too much, like congestive heart failure and all that. These are things that can lead to pulling of blood down in your legs because you're not moving. Just poor mobility. So that is why here, when people undergo surgery, we put them on what we call DVT prophylaxis, where we give them injections of either heparin or one of the newer heparins, like enoxaparin and all that, so that their blood will be thin. They even give them things like sequential compression devices that keep pumping the muscles. I don't know how much of standard practice that is over there in Nigeria, but I wouldn't think it will be as pervasive as here. Then the other thing is long trips. You have somebody fly from USA to Nigeria, 12-hour flight at the minimum, right? And this person is just sitting in his or her chair and sit without moving, without going to ease himself, stretch out, walk around. By the time you get to Nigeria, blood will have pooled in your lower extremities. There will be blood clot formation. The formation of the blood clot is not bad in itself, because if it's there, it doesn't really cause much problem. But when it breaks off, which is what it is wont to do, and travels, once it breaks off, travels up straight to the heart, through the pulmonary lung, from the heart to the lungs. It is mostly in the lungs that we have most of them, because the blood vessels in the lungs are so small. Depending on the size of the blood clot, they can cause blockage and death. And death